pleasant day to everyone. I am Dr. Amabelle Trina Gerona, a medical oncologist from Cebu. So we're going to talk today about breast cancer. So, is cancer a priority health problem in the Philippines? Of course, yes. Morbidity-wise, cancers rank within the top 3 leading cause of illness in our country, while mortality-wise, cancers rank within the top 5 leading cause of death. According to GloboCan 2020, breast cancer is the leading cause of new cases of malignancy in the Philippines, taking into consideration both male and female, which is followed by lung cancer, colon cancer, liver, prostate, among other cancers. Specifically for females, breast cancer is the leading cause of new cancer, followed by cervix, colon, lung, and ovarian cancer. So we have seen that breast cancer is the leading cause of all types of cancer and has the most cases recorded every year in the Philippines. Among women, it is also the leading cause of death. According to the World Health Organization, 24,800 Filipinos were diagnosed with breast cancer in 2018, while 8,000 died from it. So it is so sad to say that people are scared to seek early consultation. Only 30% have their breast mass checked up early, hence the cancer is localized. But in most cases, it is already discovered to be in an advanced stage, such as this picture. But with the advent of proper treatment, like chemotherapy for this case, locally advanced breast cancer could close after several sessions of treatment. So what is therefore breast cancer? So in general, this gradual increase in the number of dividing cells create a growing mass of tissue called a tumor or neoplasm. If the rate of cell division is relatively rapid and no suicide signals are in place to trigger cell death, the tumor will grow quickly in size. If the cells divide more slowly, tumor growth will be slower. But regardless of the growth rates, tumors ultimately increase in size because new cells are being produced in greater number than needed. As more and more of these dividing cells accumulate, the normal organization of the tissue gradually becomes disrupted. So this is the anatomy of the breast. It lies between the second and sixth rib. Each breast consists of 15 to 20 lobes of glandular tissue supported by fibrous connective tissue. The space between the lobes is filled with adipose tissue, or fats, and differences in the amount of adipose tissues or fat are responsible for the changes in breast size. As we can see in this picture, a tumor grows from a single cancer cell, which may eventually invade the neighboring tissues and may spread through the lymph nodes and blood vessel or to the other parts of the body. In our country, the incidence rate increases steeply at the age of 30. The incidence rate has been steadily rising since 1980 with an average annual percentage of 0.9%. Actually, the risk of developing breast cancer increases as you get older. About 1 out of 8 invasive breast cancers are found in women younger than 45, while about 2 of the 3 invasive breast cancers are found in women ages 55 or older. This is because the longer we live, there are more opportunities for genetic damage or mutations in our body. As we age, our bodies are less capable of repairing genetic damage. So before we can start with prevention, it is important to know the risk factors for breast cancer. A risk factor is anything that affects your chance of getting the disease. So different cancers have different risk factors, but having a risk factor or even several risk factors does not mean that you will get a disease. So just by being a woman is the biggest risk factor for developing breast cancer. So breast cancer occurs 100 times less frequently in men than in women. This is because men's breast cells are inactive and have a very little estrogen. Having the first menstrual period at an early age or less than 12 years old also increases the risk of breast cancer. Because the earlier your breasts form, the sooner they'll be ready to interact with hormones inside and outside your body, as well as with chemicals in products that are hormone disruptors. Also, when girls start menstruating at a younger age, the time between breast development and the first full term pregnancy is usually longer than when menstruation happens later. So during this time, breast tissues tend to be immature, overactive, and particularly sensitive to hormonal influences. Menopause at a later age or more than 55 years old also increases the risk of breast cancer because the longer a woman menstruates, the higher her lifetime exposure to the hormones estrogen and progesterone. Having your first child at an older age or more than 30 years old may also increase your risk. First, full term pregnancy makes the breast cells fully mature and grow in a more regular way. So, actually, breast pregnancy helps protect against breast cancer. It reduces your total number of lifetime menstrual cycles and exposure to hormonal influences. Bottom line is the longer your exposure to estrogen, the higher the risk of breast cancer. Women with close relatives who've been diagnosed with breast cancer have a higher risk of developing the disease. If you've had one first degree female relative, like your sister, your mother, or your daughter diagnosed with breast cancer, your risk is doubled. If two first degree relatives have been diagnosed, your risk is 5 times higher than average. In some cases, a strong family history of breast cancer is linked to having an abnormal gene associated with a high risk of breast cancer, such as BRCA1 or BRCA2 gene. About 5 to 10% of breast cancers are thought to be hereditary, caused by abnormal genes passed from parent to child. If you had radiation to the chest to treat another cancer, such as Hodgkin's disease or non Hodgkin's lymphoma, you also have a higher than average risk of breast cancer. The amount of risk increases depends on how old you were when you had your radiation. The increase is risk is highest if you had the radiation during adolescence when your breast is developing. The use of birth control pills and hormone replacement therapy. So this exposes the body to estrogen, which is a factor to develop breast cancer. The risk increases after 2 years of use. The longer the use of the pill, the higher its risk. So by being overweight and obese also increases our risk because fat cells make estrogen, and extra fat cells mean more estrogen in the body, and estrogen can help hormone receptor positive breast cancers to develop and grow. The location of the extra weight matters. So extra fat around our belly may increase the risk more than the same amount of extra fat around our thighs or our hips. Research also shows a link between exercising regularly at a moderate or intense level for 4 to 7 hours per week and a lower risk of breast cancer. So, exercise consumes and controls our blood sugar and limits blood levels of insulin growth factor, a hormone that can affect how breast cells grow and behave. People who exercise regularly tend to be healthier and are more likely to maintain a healthy weight and have little or no excess fat compared to people who don't exercise. Alcohol can also increase the level of estrogen and other hormones associated with hormone receptor positive breast cancer. Alcohol can also increase breast cancer risk by damaging DNA in cells. Women who have 3 alcoholic drinks per week have a 15% higher risk of breast cancer. The risk of breast cancer goes up another 10% for each additional drink women regularly have each day. All types of alcohol count. One drink equals 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of hard liquor. Breastfeeding can also lower breast cancer risk, especially if a woman breastfeeds for more than 1 year. There are several reasons why breastfeeding protects our breast health. So, making milk 24/7 limits the breast cell's ability to misbehave. Most women have fewer menstrual cycles when they are breastfeeding, so added to the 9 missed periods during pregnancy, resulting in lower estrogen levels. So many women also tend to eat more nutritious food and follow healthier lifestyle, limit smoking and alcohol use while breastfeeding. So smoking causes a number of diseases and is linked to a higher risk of breast cancer in the young premenopausal women. Research has also shown that there may be linked between very heavy secondhand smoke exposure and breast cancer risk in postmenopausal women. Smoking also can increase complications from breast cancer treatment, including damage to the lungs from radiation therapy, difficulty healing after surgery, and breast reconstruction, higher risk of blood clots, and taking hormonal therapies. So these are the different unclear risk factors for breast cancer. So in summary, here is the list of the risk factors for breast cancer. Aside from risk factors, it is important to know the breast cancer risk types. So this will aid your doctors in screening. So an average risk woman has no symptoms, no history of invasive breast cancer, such as breast cancer that spread beyond milk ducts or lobules, ductal or lobular carcinoma in situ or atypia, so which is also known as atypical hyperplasia. And these average risk women also has no family history of first degree relative, such as a parent or a sibling, or no suggestion or evidence of a hereditary syndrome. So average risk also has no history of mantle radiation, radiation therapy used to treat Hodgkin's disease. So how about for women with increased risk? These are women who had prior history of breast cancer, women with strong family have breast cancer, women who receive thoracic radiation less than 30 years old, and 5-year risk of invasive breast cancer or using the Gale model, and women who have a history of lobular carcinoma in situ or atypical ductal hyperplasia or lobular hyperplasia, and pedigree suggestive of known genetic predisposition. So these are the increased risks of breast cancer. So what consists our breast cancer screening? So first, thorough medical and family history, breast cancer awareness, patient familiarity with her own breast, and of course, know your risks, whether you are an average risk or an increased risk of having breast cancer, clinical breast exam, and breast imaging. So the NICA, or the National Integrated Cancer Control Act, was signed into law last February 14, 2019, to ensure the provision of quality health services and financial risk protection to cancer patients in our country. So what are, therefore, the warning signs of breast cancer? So not all breast cancers are found in the mammogram. That is why it is also vital for us to know the most common signs and symptoms of breast cancer. So in most cases, these changes are not cancer. For example, breast pain is more common with benign breast conditions than with breast cancer. However, the only way to know for sure is to see your doctor. The warning signs of breast cancers are not the same for all women. Most common symptoms are a change in the look or feel of the breast, a change in the look or feel of the nipple or nipple discharge. So these are the warning signs of breast cancer. So you may feel a lump, a hard knot, or thickening inside the breast or in your axilla or in the underarm area. You may see swelling, warmth, redness, or darkening of the breast. You may also notice a size or change in the size or shape of the breast. You may also see dumpling or puckering of your skin. You may also have itchiness, scaly, sore, or rash in our nipple. You may also notice pulling in of your nipple or other parts of the breast. So again, these cannot be found in all patients. No, you may have one of these signs and symptoms only. You may also have nipple discharge that starts suddenly and new pain in one spot that does not go away. So in summary, here is a list of symptoms of breast cancer. So one easy way to determine breast changes is to do breast self-examination. It is useful to do breast self-exam at the same time each month because the breasts tend to change as a result of changing hormones throughout the woman's monthly cycle. If you have a regular menstrual cycle, then the best time to do your breast self-exam is about 7 to 10 days after your period begins each month or at the end of your period. At this time, your breasts are least lumpy and the least tender to touch. If you don't have regular monthly periods, then try to do your breast self-examination on the same day each month. So for example, on the first day of every month, the day where you pay your monthly bills, what your bridge game or something else that you won't forget, no? So how should a breast self-examination be performed? So you may do this in the shower. So using the pads of your fingers, move around your entire breast in a circular pattern, moving from the outside to the center, checking the entire breast and the armpit area. Check both breasts each month, feeling for any lump, thickening, or hardening knot. No? Notice any changes and get lumps evaluated by your healthcare providers. So you may ask your barangay health workers, you may ask your general practitioners, you may ask your doctors to see when you see something different. No? So you could also perform your breast self-examination in front of a mirror. So visually inspect your breast with your arms at your side. Next, raise your arms high overhead. Look for any changes into contour, any swelling or dimpling of the skin, or changes in the nipples. Next, rest your palms in your hips and press firmly to flex your chest muscles. Left and right breast will not exactly match. No, few women's breasts do. So look for any dimpling, puckering, or any change, particularly on one side. So you may also do self-breast examination while lying down. So while lying down, the breast tissue spread out evenly along the chest wall. Place a pillow under your right shoulder and your right arm behind your head. Using your left hand, move the pads of your finger around your right breast gently in a small circular motion covering the entire breast area and armpit. Use light, medium, and firm pressures. No? Squeeze the nipple, check for discharge and lumps. So repeat these steps to your left breast. So once a month, adult women of all ages are encouraged to perform breast self-examinations at least once a month. So according to Johns Hopkins Medical Center, so 40% of diagnosed breast cancers are detected by women who feel a lump. So establishing a regular breast self-examination is very important. While mammograms can help you detect your cancer before you can feel a lump, breast self-exams help you to be familiar with how your breasts look and feel so you can alert your healthcare professionals if there are any changes. So how about mammogram? So just a little brief background about mammogram. So this is a screening test which use low dose x-ray to look for early asymptomatic meaning no changes yet of your breast, no, with a view that early diagnosis and effective treatment will prevent progression from disease and thereby deaths from breast cancer. So during the mammogram examination, a radiographer takes images of the breast from two different angles, by fixing the breast between two plates. Breast ultrasound. So breast ultrasound examination is used to take a closer look at areas of your breast that your doctor still has questions about doing a mammogram and clinical breast exam. So an ultrasound test may be useful if your mammogram shows an indistinct mass or if a lump can be easily felt during a clinical breast examination. So an ultrasound uses high-frequency sound waves that are transmitted through the breast tissue from a hard handheld unit called a transducer. These sound waves bounces off between breast tissues. The echoes created as a result are then recorded by a computer and makes an image of the breast tissue and displays in the monitor. So no radiation is used and very little pressure is required for breast ultrasound. Breast MRI are being used for patients with high risk. So what are these high risk patients? They have the BRCA1 and 2 mutations. They have these kind of syndromes for hereditary breast cancers, no? Such as those listed. And we have also the newer technologies, no? Full field digital mammography and breast tomosynthesis. So full field digital mammography offers less false positive and reduce the need for supplemental imaging and biopsies. So the process is the same. Breasts are compressed between two plates. Digital breast tomosynthesis, 3D mammography, uses low-dose X-ray and computer reconstructions to create 3D images of the breast. So compared to mammogram, the digital breast tomosynthesis appears to offer increased sensitivity and are reduced in the recall time. So according to American Cancer Society, women between 40 and 44 years old have the option to start screening with a mammogram every year. Women 45 to 54 years old should get mammogram every year, and women 55 and older can switch to a mammogram every other year, or they can choose to continue yearly mammogram. Screening should be continued as long as a woman is in good health and is expected to live at least 10 more years. So all women should understand what to expect when getting a mammogram for breast cancer screening. So what tests can and cannot do. No? So how do we reduce the risk of developing breast cancer? So the key to breast cancer risk reduction is having a healthy lifestyle, having more fruits and vegetables, and restricting intake of food that are energy dense or high in sugar or fat can decrease the risk of breast cancer. So if breast cancer is detected early, it can be cured, hence decreasing your risk of death. So for any more questions, you may reach us, the Philippine Society of Medical Oncology, or PSMO, through our Facebook and Instagram or in our website. Thank you. So these are the most common questions, when we have during breast cancer consultation. So can men get breast cancer? Of course, yes. It is possible for men to get breast cancer. Anyone with breast tissue is capable of developing breast cancer. However, it is less common, with about 1 out of every 100 breast cancer cases in the US developed in men, according to the CDC. No? Breast cancer in men is most often a type known as invasive ductal carcinoma, which begins in one of the breast ducts and spread in other parts of the breast. What are the chances of surviving breast cancer? Surviving breast cancer varies by the disease stage. No? Approximately 99 out of 100 people with stage 1 breast cancer in only one breast will be alive 5 years or more after diagnosis and treatment. So that is your breast mass is around less than 2 centimeter. No? When breast cancer has moved into the lymph nodes, when you have the stage 2 or 3 breast cancer, the 5-year survival rate is 85%. When the disease has moved to the distant organs or metastasis or stage 4, the 5-year survival rate is around 27%. Do all breast cancer patients need chemotherapy? So, not all patients with breast cancer need chemo. Receiving chemotherapy depends on the risk of cancer returning and the need to destroy undetected cancer cells. So, new tests can provide valuable information in chemotherapy decision making. So, if ever you're just stage one and then you have low risk of recurrence of your breast cancer, you can have no chemotherapy and may have hormonal treatment if you are ER or PR positive. So it depends. No, better ask your oncologist about it. How is breast cancer stage determined? So we most commonly determine breast cancer stage by the tumor size and cancer growth into the adjoining areas. No? Um, we also evaluate the nearby lymph nodes that are associated. We also look for metastasis, so that's why your oncologist or your surgeons may order bone scan, chest CT scan or X-ray, ultrasound of your abdomen to determine if there are any metastasis in your bones, in your lungs, or in your liver. No? So we can also determine stage by getting your breast panel, ER, PR, and HER2, and of course the visual appearance of the cancer cells in your biopsy or in your MRM stage. So with that, I bid you good afternoon to everyone and thank you for listening.